Hi there, this is Gabe with Design Team 1, and today I'll be talking about minimizing external exposure of nasogastric tubes in pediatric patients to prevent accidental removal. A nasogastric, or NG tube, is a thin, flexible plastic tube that passes from the nose through the esophagus into the stomach to deliver or remove contents. NG tubes are used for patients with swallowing difficulties, malnutrition, inflammatory bowel disease, head and neck cancers, and related conditions. When not in use, NG tubes are typically secured with tape, tucked behind the ear, or held in place with a nasal bridle. Children often pull these tubes out of curiosity or frustration, which frequently dislodges or removes them. This leads to repeated NG tube replacements, which are time-consuming, costly, and potentially traumatic for young patients. The need for a more reliable method of limiting patient interaction with and securing NG tubes in place has already been expressed by pediatricians across multiple hospitals, such as Children's Hospital of Philadelphia, UPMC's Children's Hospital, and others. Our solution aims to minimize the external component of the NG tube in an effort to limit exposure. We adopted an out-of-sight, out-of-mind mentality to prevent children from interacting with components that are visible to them. In our prototype, the external portion of the NG tube can be detached from the rest of the device, which eliminates the need to tape the external tubing to the child's face. When needed, parents can simply reattach the tube via the Lorlock system, one that many nurses are already familiar with, to ensure the secure attachment of the internal tube and prevent it from falling back into the nasal cavity or esophagus. Our design team designed a nose clip that is connected via the Lorlock and will anchor the tube to the side of the patient's nose. Our clinical mentor, Dr. Christina Stiebris, advised us not to use magnetic components, although we initially considered a magnet to secure the NG tube to the nostril. Accidental removal and ingestion by the pediatric patient could require emergency surgery. Therefore, we eliminated magnets and any small removable parts from our design to prevent ingestion risks. Another hazard is the risk of our device blocking the airflow in the nostril, especially in pediatric patients with smaller anatomy. To mitigate this, we will offer the device in multiple sizes and use breathable materials for any components near the nasal passage. After building the prototype, we will conduct VMV testing on a mannequin to identify the optimal NG tube size that avoids airway blockage, verify that the Lorlock securely connects both components, and ensure the nose clip prevents retraction into the nasal cavity. Based on our mentor's guidance, we will conduct IRB testing on adults for proof of concept. Dr. Stiebris confirmed that this is more feasible and safer than pediatric testing given the short timeline and higher risks. These tests will assess device security and overall functionality. Thanks for listening.